we're with Dr. Brent Anderson, who has many strings to your bow as a doctor, but one of those that you've recently taken on board is Androfill. So what is Androfill?
So Androfill is a UK-based company that's involved in penis enhancement, and I am the New Zealand representative for this company and have been over the last few months. But it's a worldwide company which has performed over 12,000 penis enlargement procedures and well recognised around the world in this field.
And so how does the procedure work? Like, what kind of filler are we talking about?
So the fillers we use are dermal fillers, which have been used in aesthetic medicine for probably 30, 40 years. The fillers are hyaluronic-based fillers. There's various trade names, but they all work principally as hyaluronic-based cross-linked fillers, which are injected into the penis as injected into the face or lips, and any other cosmetic procedures. So, and we've been around for about the last 10 to 12 years, involved in penis enlargement, and it's proven to be very successful and a very simple procedure, relatively, and very much like it has been in faces, lips, and other areas we've been using it for.
And are we talking about expanding the girth?
Yes, so penis enlargement is effectively girth. It doesn't involve any lengthening of the penis. The only way you can lengthen the penis is with surgical procedures, which is hazardous, and it's not highly recommended. And you don't get a lot of length, from the procedures surgically, and reasonably high risk. But this procedure is principally around a girth. It's really, really safe and very, very effective. So the dermal fillers we use, as we have been using in lips and faces and other areas of the body, are hyaluronic acid cross-linked fillers. The ones we use in the penis are highly cross-linked, therefore they last longer. So there's different ranges of fillers that are used cosmetically. These fillers are very safe because they're effectively a sugar molecule, which is hyaluronic acid, cross-linked, and therefore it's pretty natural for the body, hence doesn't have very much in the way of reaction or foreign body reaction. Hence, that's why it's been used in faces and other cosmetic procedures for many, many years.
So how long does the procedure take?
Procedure takes approximately half an hour to an hour. That depends on how much volume we use. We usually spend a bit of time numbing the area to topical anaesthetic, and sometimes inject a bit of local anaesthetic to the base of the penis. After that, the filler is inserted through a cannula. The cannula is effectively like a long blunt needle. Can be used a smaller needle to make a small entry point, and the cannula is inserted in, and the penis is filled using the cannula technique.
Is it filled from the bottom or the top?
The procedure for me is done from the base.
Right.
But I have done it from the top as well. The results are instant. The patient may want a little bit more filler on the day, which is fine. We adjust the volume of filler according to the patient's desire and what the result looks like after the procedure. So it's very customised on the day. Usually we inject somewhere between 10 to 20 mils, and that's obviously dependent on the size of the penis and the expected result or increase in girth that you desire afterwards. It's a painless procedure, believe it or not, and because we're not using needles, the cannulas are effectively painless because they pass through the soft tissues, and because they don't cut nerves or vessels, there's very minimal bleeding, if any. And because the nerves aren't affected in any way because it's not a sharp needle, then it's actually quite painless. We do use local anaesthetic at the base of the penis and a bit of topical, but most patients, tolerate procedure incredibly well, and are surprised how painless and simple it is.
How long till you can use your penis after you've had the treatment?
Filler is reasonably mobile initially. That's why people have to afterwards manipulate for a little bit to get a bit more evenness. But after a period of about 2 to 3 weeks, then the filler's more stabilised in this position, so that's when you can have sexual intercourse.
So you're the only one in New Zealand that does this, Brent?
Yeah.
Based here in Taranaki, but we can take this treatment across the country?
Yes, yeah. Currently the only one doing it for Androfill. And we do offer the services throughout New Zealand, but at this stage I'm actually subsidising people to come to visit me in New Plymouth, only because the numbers of patients we have at the moment, are just sort of getting established. So Eventually, once the numbers increase, we'll be doing clinics throughout the country. But if you book to come and see me, often we'll give you a discounted rate to cover some travel expenses.
So tell us, Brent, how safe is the treatment?
Well, dermal fillers are very safe. They've been around in cosmetic medicine for some 30 odd years. There is the odd complication, but it's pretty rare, largely bruising, infection, and occasionally you can get reaction to the fillers, but that's extremely rare. If that does occur, we use Hylase, which is an enzyme that dissolves the filler out, and usually any side effects or concerns are alleviated with the filler dissolving. There's vascular complications is a major concern for facial aesthetics. I haven't seen that in penis fillers, but it's a potential risk, but it's an extremely rare complication. And I've been doing fillers for 35 years. I've never had one of those events yet. Apart from initial bit of bruising, maybe a bit of discomfort, generally it's painless afterwards too. All the patients that I've had so far have only required a bit of Panadol for a day or two, and have suffered no adverse events to date. And I've been doing penis fillers for 2 years and aesthetic fillers for 35.
Brilliant. Okay, and so bookings are open?
Yes, bookings are open here. More than welcome.